I was first diagnosed with sickle cell when I was 5 years old. I wasn't feeling very well. My mom couldn't figure out what was going on. She took me to the doctor, and at that time they diagnosed me with sickle cell disease. As I was growing up, I was tired a lot. I had a lot of achy joints. I didn't understand what sickle cell was. As a child, I didn't know how to manage my pain. As I got older, I recognized that even though my mind didn't have limits, my body has limits, and I had to listen to my body.
So my parents honestly tried to make me always feel included. So they told me that I was different, but no different, in the sense that I needed to take medications, whereas some children may not need to do that. I needed to watch stuff that I did in terms of play, in terms of ensuring that I didn't get overheated, stuff like that.
So in high school, I was able to play sports, but not without consequences. Some of the issues I would have with my sickle cell crisis would be extreme pain in my hips and joints, as far as my shoulders, my elbows, my legs. Sometimes I couldn't walk at night. I would have cramps, and I would miss time on the football field and the basketball court as a result.
For me, a pain crisis generally looks like excruciating pain. So generally, I am in a fetal position and often require attention and help and assistance from my family. At that point, it may include hospitalization, or it may include guidance from my provider that tells me what I need to do to get through that.
Many of our most successful patients in managing their chronic and severe pain have gotten in front of the pain and anticipate problems in order to prevent an emergency room visit or hospitalization.
As I got older, I figured out how to constructively do those things. A lot of time what that looks like is, as I start to feel small aches and pains, I have to stop. In the past, I would just keep going. As life sped up and I would develop those aches and pains in my joints, I would just stop, I would slow down, I would make sure I'm drinking plenty of fluid. I would get a warm rag or a warm towel to put over those aches and pains. And sometimes it took a day, sometimes it took 2 days, sometimes it took 3 days, but eventually I would feel better and I can get back to my natural life.
When it comes to chronic pain and sickle cell disease, there are a lot of factors that have led to chronic pain, and so a lot of approaches, and usually more than one approach, needs to be taken to help manage chronic pain. So we know that physical therapy, mindfulness, diet, activity level, all of those things have a huge role to play. But sometimes there's been nerve damage from sickle cell disease. Sometimes you've had so much pain that it confuses your nerves. And there are medications that are not opioids that can really help with that pain. There are nerve pain medicines. There are medicines that originally were to treat depression that can really help kind of unbundle and unconfuse those nerves and make a huge difference in the lives of people with sickle cell disease and chronic pain.
At various times I did try pain medications to manage my pain, but it affected me in a negative way. It would affect my schooling, I would fall asleep a lot, it would affect my time with my family sometimes, my reaction time, my alertness, and I felt like I just couldn't be functional and keep doing those pain medications.
One of the things we encourage our patients to do is to surround themselves with supportive people that will encourage you to stay involved in community and not isolate yourself, which could lead to depression, anxiety, and increased pain.
I think my advice for people who struggle with pain management would be, again, not to isolate themselves, but to find a good support network, or a network of friends, or even people that may have similarities in your condition.
So it's important to stay in part of that community that's with your doctors, that's with positive people, your family that understands the disease, or other people that you've known or you trusted over a period of time. Some of those people in my community are people that I've developed friendships with at Camp Hope, which was a sickle cell and cancer camp for children that we went in the summertime. And so some of those friendships and relationships I still have to this day. And all of those people are doing positive things in their life, so it motivates you to keep being positive and resist the temptation to withdraw, because that leads to a lifestyle that's unhealthy.
So don't allow sickle cell to limit you in any way. You have the potential to do anything that you set your mind to. You can be anything that you want to be. It is a complication, but again, it is not something that should control who you are and what you do.
So when I hear patients say, I have sickle cell, it doesn't have me, that's really exciting to me, especially when I see they're out there, they have families, jobs, they're involved in the community and churches. They're living their lives to the fullest and they're not letting a diagnosis define who they are. I find that incredibly hopeful and encouraging.